We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. We who believe in freedom.
Hello, everyone, and welcome to the Mother's Justice Show on 1150 KKNW. I'm so glad you're here with us today. Thank you for tuning in and supporting the voices that are working to create healing, justice, and real change in our communities. I'm your host, Sylvia Feliciano, sitting in for Reverend Harriett Walden, founder of the Mother's Justice Show. I'm a Marine Corps veteran, mental health advocate, and founder of Solace Mind. At Solace Mind, we focus on making healing accessible through trauma-informed care. We offer life coaching, hypnotherapy, mindfulness, and stress management programs, and emotional wellness tools and solutions to help organizations and their workforce, individuals, and communities build resilience, self-awareness, and emotional regulation. Today, for Memorial Day, we pause to honor those who gave their lives in service to this country. We remember those who never made it home from war. We also honor those who returned but carried invisible wounds, trauma, moral injury, and pain that never fully healed. We may never fully understand the experiences of those who lost their lives due to their military service, but we know they served, we know it changed them, and we know they mattered. This day is for every service member whose life was cut short by the cost of their service. You are remembered, and Joshua, your story is not forgotten. We honor you all. For today's discussion, we want to explore important topics related to grief and other ways to support mental health. With me today, I have the pleasure of introducing Danielle Hughes, a fellow U.S. Marine Corps veteran, Semper Fi, and a licensed professional counselor based in Colorado. With over a decade of experience, Danielle specializes in trauma and PTSD, relationship issues, and ketamine-assisted psychotherapy. She's trained in EMDR, psychobiological approach to couples therapy, and relational life therapy. She brings both clinical expertise and lived experience to her work, supporting clients in navigating healing, connection, and personal growth. Danielle, thank you so much for being here. You and I met at a retreat where I experienced ketamine-assisted therapy for the very first time. My first session brought me so much peace after losing my son, Joshua. The only way I can actually describe the experience was feeling the profound love I have for my son and being overcome with that love, that I was able to actually embrace grief at the same time. It gave me a sense of peace that I hadn't experienced since my son's death. You've helped so many people, and it's why I wanted to invite you to have this discussion with me, to bring the awareness of such an important alternative therapy. How did you start working with ketamine-assisted therapy, and can you tell us what it is?
Hi, Sylvia. Sure. Yes. Thank you for having me. It's an honor to be here. Um, yeah, I guess just to go right into answering your question, also just want a minute, take a second to honor Joshua's life as well. Actually, hope it's okay to do that here.
Of course, absolutely.
Yeah. Well, I started working with ketamine as a patient, actually, due to my own mental health issues, PTSD in particular, service-connected trauma, and was recommended to try ketamine by my psychiatrist. I had been probably at one of the lowest points I had been in for a really long time and wasn't responding to multiple types of different therapies and medications. And I had actually asked her for ECT, electric shock therapy. It's not the technical name for it, and she had been trying to get me to try ketamine for over a year, and she kind of made a deal with me and said she didn't think I'd be a good candidate for ECT, but if I was willing to try ketamine and it didn't work, then she would let me go try ECT. And so I was lucky enough to get a referral. My psychiatrist is through the VA, so I was lucky enough to get care in the community, which I know a lot of people are not lucky enough to get. But I ended up going to an infusion clinic, an IV clinic, getting ketamine, and it was a game changer for me. I was living with chronic suicidal ideation at the time, and it was the only thing that helped that go away or reduce. And so I did that for about a year as a patient, and then obviously saw how helpful it was for my life. Saw some people around me also utilizing ketamine, who happened to also be veterans and living with lots of trauma symptoms, and decided to get trained in ketamine-assisted psychotherapy and psychedelic-assisted psychotherapy in order to integrate that into my practice to help people that, were also like me and struggling and not finding the response to medications that, we would like to see. And so integrated it into my practice and began working with medical professionals, psychiatric nurse practitioners and psychiatrists who were able to prescribe medication, and began helping other people using ketamine.
Thank you. Thank you for sharing that. Thank you for sharing your story as well, because I too sought out the ketamine assisted. I wanted something to help me with the grief. I knew I needed to reach out. And I posted on a veterans Facebook post, which is where I was contacted about the ketamine retreat where we met.
Mm.
And so I'm just so very grateful because Danielle provided such trauma-informed care. And we'll discuss shortly about what to look for, because it's super important to be in a safe environment when being administered ketamine. It has been used for some time. It's been around for some time, but it's now being widely practiced in traditional therapy settings, right?
Yeah, it has been around for a long time in the medical setting. It's used in anesthesia, and I think it has been used off-label for psychiatric conditions for a while, but I think it's becoming more mainstream and more widely known and understood.
Right. And you mentioned community care. So that's how I accessed, well, I didn't access it through the VA. I accessed it through the retreat that was covering veterans. It was being provided to veteran organizations. It was a veteran organization that provided it to veterans. But I know that the VA has approved the community care, that and also Spravato, which is the nasal version of the ketamine that's provided in community care settings. So if you're a veteran that is interested in seeking ketamine-assisted therapy, you can go to your primary care provider or mental health provider and ask for a referral for community care, because typically some of the VA facilities aren't even equipped for it, right?
Right. I think there are some around the country who are offering it, and then I think there are some who are offering care in the community and some who are still not. I think it's still not so mainstream that all of the providers are on board yet, but
Right,
hopefully
right.
getting there.
Yeah, hopefully. How is it used in trauma work?
So I have a kind of a little bit of a maybe not so straightforward answer on that. In trauma work, so the providers that I work with and collaborate with, we do oral troches, a little bit of intramuscular, as far as in the therapy setting, and we do various types of dosing. And so we can do lower dose ketamine uh, work where you're not in a psychedelic experience or a psychedelic state, but more of a psycholytic state where you can. So ketamine, I guess I forgot to answer this earlier. Ketamine is a psychedelic, and it's also like an anesthetic. It's a dissociative. So when we're using it at kind of a lower dose state, people can still talk, they can still feel their body. We can do deeper work. We can still dig into some of the deeper wounding things or things people want to explore. And it kind of it creates new neural pathways in the brain. There's neuroplastic effects from ketamine. And so we utilize the benefits of the medication in that way. We also do some what I call higher dose ketamine, but it's still not it's not an anesthetic level. It's a psychedelic level of medicine where someone has what we call a psychedelic experience, and some people can disconnect from their body, not feel their body, and have a psychedelic experience, which is, can be expansive and being in an altered state of consciousness like that. And you can, I think, as like you mentioned, Sylvia, you can sometimes feel expansive love coupled with carrying the grief that some of us carry, and able to kind of process that in a more expansive way.
Right. Yeah. Thank you for that. We're going to take a break, but when we come back, I really want to talk about how people can prepare, even look for what to identify, how to choose a ketamine-assisted therapist or a facility or even a retreat. You're listening to 1150 AM KKNW, the Mother's Justice Show. We're going to take a short break and we'll be right.
And take my pain like an empty bottle takes the rain.
The Mother's Justice Show is brought to you by H.G. Walden and the Virtues Healing Circles. Join us for Wisdom and Wellness with Reverend Walden, a monthly virtual and in-person healing circle that focuses on community healing and growth. Learn more at virtueshealing.com. That's virtueshealing.com. Also, be sure to join our healing group on Facebook. Again, visit us at virtueshealing.com today.
Market Street Shoes is happy to sponsor the Mother's Justice Show in honor of our mother, Jackie Higgins Rosebrook, who spent her life fighting for social justice, and also in honor of all mothers who fight for social justice. Market Street Shoes, fashionable footwear and apparel for life's everyday adventures, in the heart of Ballard since 2006. Visit marketstreetshoes.com.
Hey, it's Kristen Rao Finkbeiner of Breaking Through. I'm so glad you're listening, and I hope you listen to our show. We're on Mondays at 5 a.m. It's a show that tackles the top topics facing our nation and gives you, yes, you, ways to take action, ways to make your voice heard, ways to create change, ways to lift our nation and protect democracy. Again, Mondays at 5 a.m. We have fabulous guests, we have fabulous ideas, and a conversation that you're going to want to join. Talk with you soon.
No other station delivers this much variety. Alternative Talk 1150.
And
And we're back on 1150 AM KKNW on the Mother's Justice Show. We are here with Danielle Hughes, a licensed professional counselor based out of Colorado, to discuss ketamine-assisted therapy. Before the break, Danielle, we were discussing how ketamine helps folks with trauma and other mental health challenges, disorders, and such. But it's really important because there's so many different sites now and therapists that are offering ketamine-assisted therapy. How does one looking for ketamine-assisted therapy, what is it that they should look for to ensure that they're entering an ethical and safe treatment environment?
Yeah, that's a great question. Well, and this is not an exhaustive list, but I would really want to make sure someone's looking for someone who's trained in psychedelic assisted psychotherapy. So someone who's had at least one type of training, if not more. Someone who is trauma informed, and I mean that, I guess, you want to make sure someone's got different types of therapy trainings that includes trauma training, so different modalities that are trauma based. I would ask a lot of questions about, the set and setting, how they incorporate ketamine into their work, what type of consultation and supervision they seek, whether they've used the medicine themselves, what the environment is going to be like. Do they include preparatory and integration sessions? So do they prepare you well prior to the medicine? What do they do? How do they handle, during the medicine, after the medicine? How strong are their boundaries? Are they ethical? Do they practice ethically? I think it's also okay to ask for referrals, ask for people that have experienced work with this clinician. I know that in the therapy world, you can't necessarily ask to speak to other clients, but we have professional resources we can always, offer people. I know this gets a little tricky with people who are pre-licensed or on their way to licensure, but and this is my own personal bias, so I totally own that. And I know that this is maybe not going to be a consensus across the board, but I would probably recommend you doing medicine with someone who's licensed or on their way to licensed and being supervised closely. I know that there is underground work with other psychedelics, and some medicine spaces, there are people that are, are medicine is part of their actual culture. And so, that's also something to consider. I don't want to, those people may not be licensed. They might be like actual shamans and people who have trained in cultures and whatnot.
Yeah, and we want to make a very clear distinction and also make some disclaimers. This is not medical advice in any way whatsoever. So, we want to be ethical as well. Check first and foremost with your mental health and your primary care providers before ever seeking any alternative therapy. And we also want to stress that we're just talking about ketamine-assisted therapy in a therapy setting. All of the indigenous practices, Western medicine can really muck that up. So that is, definitely something I don't want to touch in the same conversation that we're talking about Western medicine. And I appreciate you stressing the importance of being licensed, because just in my own experience, I know very well that it could become a serious challenge and even be unsafe if those who are administering or coordinating or even working and integrating with clients at any ketamine-assisted session, if they are not trauma-informed, a lot can go wrong. A lot can go wrong because you are under the medication and you have to be able to trust that you're not going to be psychologically harmed, which can very well be the case. And so that's one of the risks if you're not selective and diligent about doing your research in ensuring that the practice, the session, the environment, the people you're going to interact with are trauma informed and not just like a nurse or, some other non-mental health provider assisting and administering the ketamine.
Yeah, and and it's hard because I think something that I've experienced is, someone can also on their resume look like they're trauma informed. They can have taken all of the trainings, and that can still not be, there can still be things that go obviously wrong, and maybe they don't actually practice ethically, or they cause some harm. So that's where I say, yeah, be very selective. Trust your gut. If something feels off, follow that. I would say, given some experiences and, that we've shared and not shared, I've become or becoming even more selective about other clinicians that I'll even do work with in the retreat space. And so, or people in general, not even just clinicians. And so, yeah, making sure that people are trained well and ethical, well boundaried, no dual roles, making sure physical touches, is uh, is explicitly discussed, boundaries around all kinds of things that don't even include physical touch also.
Right.
Making sure the
And
environment.
I do want to absolutely to keep the environment safe, and it's very important. And it can sound scary to some people, everything that we just listed, but it really is like anything else. Mental health care is very important. And when a provider is trauma informed, um, trained, they take into account um, the entire setting, the entire environment for the patient to ensure that it is safe, whether we're talking talk therapy, hypnotherapy, any other kind of healing modality. You just have to do your due diligence to ensure that you're not just trusting the provider, but anyone that is in that setting. So I highly recommend, especially because of my experience with my profound grief losing my son, I highly recommend the ketamine under guidance. If you're cleared, if you go through your mental health provider and primary care provider, and they give you the go ahead. Many providers really encourage. My mental health provider encouraged me to go seek ketamine because of its profound benefits. But again, like anything else, you buy a car, you do your due diligence to make sure you're not scammed. More importantly, you have to take care of your physical and mental well-being. And so more due diligence is required, and advocacy. Make sure you're advocating. If something doesn't feel right, then you move on and continue your search. But I absolutely recommend ketamine-assisted therapy.
Yeah, I agree. And I do too and it isn't for everyone. So that's the screening process, making sure that you're screened appropriately. But yeah.
And how would you recommend preparing and integrating for ketamine once you've found someone?
Well, I think that's kind of broad, but I would recommend that they're looking for a clinician who does do preparatory and integrative work with the psychedelic. And so the clinician would hopefully do a few sessions of what we call prep. And so those would be managing expectations, talking about what could, all the different things that might come up, all the things that might not come up during your journey, how to prepare for that emotionally, physically. Um, and then integration is usually, I like to say 24 to 48 hours after the medicine. And that's, it can kind of look like a therapy session, but you're looking for, you're talking about with your clinician, what came up in your journey? What has come up since your journey? Are you having new awarenesses? Are you making new connections? And so it's kind of a deeper process to maybe the therapeutic process, going over what life is looking like since you did your ketamine journey or anything that may have come up in the journey, and processing that on a deeper level and taking advantage of the neuroplastic effect of the ketamine and integrating that into your day-to-day life, maybe making new changes in your day-to-day life. If you have more energy, maybe you have an ability to move your body a little bit more. And so it's following that. Maybe you have less certain food cravings. And so you're following that and you're integrating that. Maybe you're now open to journaling. And so you're doing that, or you're noticing a more creative side. So you're, getting out the paints, or, whatever it looks like for each person is a little different, but doing the things that you feel called to do, or maybe it's noticing an absence of thoughts or an absence of things. And so, noticing that and following that and integrating that into your day-to-day life.
Thank you for that. And what comes to mind also, what we were told as we were preparing and integrating, limiting the exposure to any traumatic experiences, whether that's social media, whether it's in real life, just really limiting your exposure to anything that can disrupt that neuroplasticity, pathway that your brain is continuing to create well after the ketamine.
Yeah. And I recommend that too for myself and for clients. Like we say, try to stay off whatever may bring kind of things that could stifle your ability to take care of yourself. So I, recommend people, if you're able to take, not everybody can do this, but take time off of work or take time out of your day to rest, relax, be in nature, shutting off the things that would be kind of, disruptive to that kind of neuroplastic kind of piece of the brain. And also and not everybody has the ability to change their environment while they're going through ketamine-assisted psychotherapy also. So I also like to kind of say, hey, if you're going back into the same environment, sometimes you can't help that. And we'll try to figure out ways to kind of reduce, if it's not a healthy environment, we try to reduce your exposure to that. We can get creative, but don't also want that to be a limiting thing if somebody needs help. The nice thing about ketamine is it can be very effective very fast, especially people who are dealing with treatment-resistant depression, PTSD, OCD, anxiety. If you are having suicidal ideation and you just need help, we want you to get help.
Right, absolutely. Thank you for that important reminder. We don't want it to be a deterrence.
Right.
Because there are immediate benefits in the ketamine-assisted therapy. Thank you for that discussion on ketamine. We're going to take another break, but when we come back, you raised and brought to my awareness something that I hadn't even heard of, and I wanted you to bring it to our audience because it's so very important. How antibiotics can unexpectedly impact our mental well-being. You're listening to 1150 AM KKNW, and we'll be right back. We're taking a short break. Thank you for listening to the Mother's Justice Show.
And take my past and take my sins like an empty cell takes the wind.
Market Street Shoes is happy to sponsor the Mother's Justice Show in honor of our mother, Jackie Higgins Rosebrook, who spent her life fighting for social justice, and also in honor of all mothers who fight for social justice. Market Street Shoes, fashionable footwear and apparel for life's everyday adventures, in the heart of Ballard since 2006. Visit marketstreetshoes.com.
The Mother's Justice Show is brought to you by H.G. Walden and the Virtues Healing Circles. Join us for Wisdom and Wellness with Reverend Walden, a monthly virtual and in-person healing circle that focuses on community healing and growth. Learn more at virtueshealing.com. That's virtueshealing.com. Also, be sure to join our healing group on Facebook. Again, visit us at virtueshealing.com today.
Chef Jamie Gwen here, looking for a way to add a little more zest to your cooking? Tune in Saturdays at 5 p.m. for a show all about fabulous food. I'll share delicious conversation for cooks of all levels and share food, wine, and more with you. I'll tempt your taste buds to help make every day more delicious. So I'll meet you this Saturday, 5 p.m. right here on 1150 KKNW.
Don't miss Food and Wine with Chef Jamie Gwen, Saturdays and Tuesdays at 5 p.m. and Sundays at 4 p.m.
Find out the latest about your favorite shows on Alternative Talk 1150. Check out 1150kknw.com.
And tell me something less, because something
Welcome back. You are listening to Reverend Harriet Walden's Mother's Justice Show on 11:50 a.m. KKNW with Sylvia Feliciano. I'm your host, and today our guest is Danielle Hughes. And before the break, we were talking about a conversation that you brought to my awareness, and I was saying that I really want the audience to hear because it was something I had never considered or even heard. And it was that there are studies that antibiotics can unexpectedly impact mental well-being. How did you come across this, and can you talk about that?
Yeah, I also had no idea. And I happened to be having lunch with a friend of mine a couple weeks ago, and uh, she just so happened to be telling me she's a therapist as well, but she happened to be telling me that she had a family member who had gone on an antibiotic and their mental health had rapidly declined, and they were able to connect that it was the antibiotic. And at the time, it just so happened that I had been, I think, 2 weeks into a pretty serious antibiotic regimen for a health condition that I'm dealing with. And I, my anxiety had been like off the charts in an indescribable way since I was able to connect as I was talking to her since I started the antibiotic. And she was sharing with me that uh yeah, there's some research studies that show that antibiotics can impact our mental health, and how they do that is they can which we know they kill bacteria, but they also can kill good bacteria in our gut. And so the brain gut health connection, apparently, which is kind of new to me, but I was astounded to learn this.
Yeah, apparently there's the connection between the gut microbiome.
Hmm. Yeah.
Can you talk a little bit about that?
So I don't know, I don't have the clinical or the medical language for it. I've read some of the articles, and I don't know if you have a way to share that with your audience, but it basically disrupts the gut microbiome and essentially wipes out all of the beneficial bacteria that we carry in our gut. Um, and I was reading in one of the research studies that it also, some of them can, I think, let's see, cross the blood-brain barrier, if I got that correct.
Right. There's a study on the National Library of Medicine, antibiotics and mental health, the good, the bad, and the ugly. And I really encourage folks to read it. It is extremely informative, and we're learning about this as we speak because this is just something new. It's a study from 2022, but it's a concern because there are times that folks may go undiagnosed or be misdiagnosed because their provider has not made the connection between the antibiotic and some of the symptoms that they're experiencing. So it's important that you have a conversation with your mental health provider, with your primary care provider. If you are on antibiotics and you're experiencing just different behaviors, what were some of the symptoms that you experienced from your experience on antibiotics that let you know, wait, this is not normal?
Yeah, and I will say, like, even as a mental health professional, I really minimized my own side effects, symptoms, and just kind of tried to power through. But I mean, I felt like, and my skin was crawling. Felt like I had heart palpitations. My anxiety, chest tightness, sweaty hands, my struggles. I wasn't sleeping. Um, I felt kind of a revved up feeling. I felt irritable, and my normal regimen of medications were not also working at this as well. And so that was another kind of cue I was having to take, which is never a good sign, take more medication than I normally take. And yeah, it was just, level of anxiety I have not experienced in a really long time. And I've read that, depressive symptoms can increase, people can experience psychosis as well as increased anxiety.
And thank you for bringing that important awareness, because again, without this information, we're potentially getting misdiagnosed or undiagnosed when we're receiving the good benefits of antibiotics, but then also it's impacting us and our mental health in ways that we're not informed about, and perhaps maybe mental health providers or primary care providers are not aware of. So it's important to have these conversations and advocate for yourself. Again, this is not medical advice. This is just bringing awareness of things that we're now learning. In 2025, this study was done in 2022. So we just wanted to bring the awareness to the audience that if you find that you're experiencing some behavioral changes while being on antibiotics, it may be the antibiotics itself. And to raise any concern with your mental health providers and primary care providers, just so that they become informed, if they're not informed, about that link between the antibiotics and mental health care, your gut health.
Mm-hmm. And I have to say, I've heard people talk about the gut-brain connection and good gut health and microbiome and all of that. And I've always believed in it. I've never gone down a deep dive and applied it to my own life, which is, of course, how it works, right? And I honestly, even, a few weeks into the antibiotics, was not connecting that was what was wrong or what was going on for me. And so, it's like a new level of awareness unlocked when you
absolutely. Well, you don't know what you don't know, right? And then do better once you do. So how can people restore? Have you gotten to this part yet? What did you do for yourself to restore your balance and support your own emotional wellness after finding out about this link?
So I haven't gotten to that point yet, but I've been doing some reading. Taking prebiotics, eating fermented foods, reducing your stress, hydrating. Those are some things that I've personally started to implement. But I was reading that probiotics are often something that's, and again, this isn't medical advice. This is just what I'm reading and what I'm learning as I go. But people often say take probiotics, but it's from what I'm reading, we shouldn't be taking those until we're done with the antibiotic. And so,
okay.
Yeah. So I guess just, recommend, good food. There's certain foods that you can eat that are considered prebiotics, foods that you can eat that are probiotics. I would, seek medical advice or talk to an integrative doctor to kind of do the process that would maybe work best for your body to support your good gut health and recovery. I think there's things you can do before you start the antibiotic, things you can do after as well to help support that.
Sure. Yeah. That's so important. And again, raise it with your mental health care providers and your primary care providers. If you do see a change, that's indicative that you may be experiencing those effects from the antibiotics, especially if there are symptoms that are not a part of your norm or your what we call baseline behavior and patterns. So thank you so much for bringing that awareness. And I know it's new. It was just brought to your attention. You just brought it to my attention. So I'm definitely going to do more research and bring that information back to the audience once we learn more, but I just felt it was really important to start the awareness. That's the purpose of the Mother's Justice Show, bringing the awareness of the healing, the justice, and the advocacy, because we know that there are health disparities, and there's not a lot of information, and people go misdiagnosed or even undiagnosed when they don't have the proper information, the awareness, or even the questions to ask their primary care provider or their mental health care provider. What are some of the ways that you bring advocacy into your own therapy sessions?
I would say, and I don't know if this is the best answer, but I mean, the way that I bring advocacy in is just listening to my clients and either helping them feel empowered to advocate for themselves or helping point out areas where they maybe don't recognize that they were mistreated and helping support them in, healing from that, and then hopefully becoming more empowered to speak up for themselves and supporting them and being an advocate if they need additional support or need another voice to help navigate a system, and if there's a way that I can do that. Being curious, wanting to know as much as I can about them and their life and their culture and their history, and ways I can help understand their lens on the world better to help support them and advocate.
Yeah, thank you for that. It's so critically important that our medical care, mental health care providers be advocates for us, especially when we don't have the information, the awareness, the psychoeducation. It's so incredibly important for our providers to advocate for us. We have to be informed to be able to advocate for ourselves, but there are times where we don't know what we don't know.
Right.
And so we have to use our platforms, as we are doing now, to bring that information so that people can be better advocates for themselves, so that it'll help their providers be better advocates for them. So thank you for that. Thank you, Danielle. We're going to take a short break. You're listening to the Mother's Justice Show, 11:50 a.m. KKNW. We'll be right back with Danielle Hughes.
Market Street Shoes is happy to sponsor the Mother's Justice Show in honor of our mother, Jackie Higgins Rosebrook, who spent her life fighting for social justice, and also in honor of all mothers who fight for social justice. Market Street Shoes, fashionable footwear and apparel for life's everyday adventures, in the heart of Ballard since 2006. Visit marketstreetshoes.com.
The Mother's Justice Show is brought to you by H.G. Walden and the Virtues Healing Circles. Join us for Wisdom and Wellness with Reverend Walden, a monthly virtual and in-person healing circle that focuses on community healing and growth. Learn more at virtueshealing.com. That's virtueshealing.com. Also, be sure to join our healing group on Facebook. Again, visit us at virtueshealing.com today.
Diabetes is on the rise, putting healthy vision at risk. Diabetes-related eye disease is the leading cause of blindness in adults 20 to 74. It's appearing earlier with greater frequency in younger people. Try to prevent vision loss from diabetes by getting dilated eye exams, regular health checkups to monitor blood glucose levels, and follow a diabetes treatment program as prescribed. Learn more at preventblindness.org/diabetes. A public service message from Prevent Blindness, United Healthcare Vision, and this station.
Talk radio with a purpose. Alternative Talk 1150.
So please heal from depression, Jesus, from suicidal thoughts,
Welcome back to the Mother's Justice Show on 11:50 a.m. KKNW. I'm your host, Sylvia Feliciano, and my guest today is Daniel Hughes. We have been talking about different alternative therapies. We've been talking about antibiotics impacting mental health. And as we were going into the break, we started discussing what advocacy looks like in the therapy session. And I want to talk a little bit about what happens in a therapy session, possible things that can happen, and ways a client can guard themselves to ensure they are in a safe space. And if they don't feel like they're in a safe space, the things that they can do. But what does it look like to not be in a trauma-informed space? Because gaslighting can take place, and people may question themselves and their gut feeling, their intuition, if they're experiencing what they don't know is trauma because they think they're in a space that's supposed to be safe. What are the risks of power? What does power imbalance look like? Potentially look like in a therapy session. And I ask this for a reason because I'm going to go into an experience that I had, and I want to do that because I want to, again, inform our audience what it can look like, and steps you can take. But I'm pursuing my mental health counseling, and we're held by very high standards, ethical standards, the ACA Code of Ethics. But there are times where there may be boundaries that are crossed. You mentioned boundaries lots of times when you were explaining some of the things that we need to be aware of and questions we need to ask to ensure that there are boundaries that are kept. Can you explain a little bit about what power imbalance looks like in a therapy session?
Well, I mean, power imbalances can look like a bunch of different things, really. And I probably didn't prepare the best for that answer, but things that come to mind are, and especially when you're using psychedelics and ketamine, like, people need to feel emotionally and physically safe. And when there's a power imbalance, people can just simply not feel physically or emotionally safe. And that can look different for everyone, depending on, your history. But I think one of the things that comes to mind is when we feel exposed or exploited, there's a power dynamic at play, likely. Things in the therapeutic setting and psychedelic as well, like physical contact, things like collaboration should be be there. If something, choices are important. People should have choices. And I do hear this even just in the regular therapy kind of setting. Like people will come to me and say that they didn't feel like they could tell their therapist that they did a certain thing or they experienced something because they felt like their therapist was going to like get mad at them or shame them or tell them they were wrong. Like that's a problem. Like, that we should always feel like we can speak up. I know we don't always feel like we can speak up due to trauma histories. However, there's a difference between we feel like we can't speak up because we have this thing, this trauma we're working on and we're trying to work through that, versus we can't speak up because we're not being listened to, we're not being believed, we're being gaslit, we're being told we're wrong. That's problematic. That's a power dynamic. And the other thing to keep in mind is like, if you're in a space and someone's positioning themselves as a quote unquote healer, I have such a problem with that word, even as a clinician. Like, I am not a healer. I help people tap into their own inner healing. I might provide a mirror for that. I might provide a space for that, for them to dig into some stuff, but I am not a healer. And I know this is my own bias, but when people position themselves as healers or that there's a power dynamic at play there. exploiting people from marginalized communities. That's a power imbalance. People should be respectful. People should have awareness around cultural differences. And I guess not exhibiting dual role behaviors. So dual roles, like, should not be, offering therapy and then also becoming friends with your clients. So you should not be someone who's kind of in charge of someone's, in charge is not the best word, but, treatment planning, but then also receiving treatment alongside them. Like, that's a dual role. You should not, I've seen it in the retreat space, people who are, kind of running things, but then drop into being a participant. That is a dual role. Like, that should not be happening. Your medical provider either your clinician, your prescriber, or if in the retreat space, a facilitator should not be doing medicine with you at the same time. Like, in ketamine, like, I know in some indigenous practices, they do, actual shamans who are true to being shamans do.
Right.
But, that's
again, this is
about that. Yeah.
Ketamine. Yeah. And thank you for that segue, because I did want to circle back, and all of this, the conversation that we're having is relatable and my own lived experience, because as you know, I experienced psychological trauma from a male therapist at the ketamine retreat. And he wasn't removed from the premises because he was actually funding. He was a funder of the retreat. And so he was problematic, not trauma-informed, although he has professed to be trauma-informed trained, not trauma-informed. And so because there was harm done, I had no choice but to report him because of the harm that he did to myself and to others at the retreat. And I provide this personal disclosure simply because the power is in your hands. As a client, when you experience something, I want you to be empowered to take matters into your own hands and seek justice. That's what it's about, knowing that you have resources at hand to be able to ensure that your space is a safe one. Thank you so much for being on the show, Danielle. Today's conversation reminds us that healing is not linear, and it isn't one size fits all. Whether it's through traditional therapy, ketamine-assisted sessions, or simply speaking the truth of our stories, healing is possible when we're seen, supported, and given space to explore. If you're a veteran, a community member, a loved one, or someone navigating emotional pain, know that there is help and you deserve care that honors your full experience. To Danielle, thank you so much for your service, your clinical insight, your experience, and just the space that you provide for clients to be able to go internally and seek that healing for themselves, guide them to that. The way you show up for others, thank you for that. To our listeners, thank you for being here. This Memorial Day, may we honor all who served, including those whose battle continued long after the uniform came off. You're listening to the Mother's Justice Show on 1150 KKNW. Be blessed and take care.
We who believe in freedom, that freedom cannot rest. One more time now, we who believe in freedom, that freedom.